This week's Ask Dr. Durie comes from a patient wanting to know, what is MGUS? And so this is obviously a very important question since we use this terminology MGUS quite a bit. MGUS is monoclonal gammopathy of undetermined significance. And what this means is that a monoclonal protein, which is characteristic of myeloma, has been discovered in the blood of a patient. Now, in the case of MGUS, this level of the protein is rather low, and it is in a setting where there are no findings that indicate an active myeloma. And so there is a very low level of myeloma-type protein in the blood, but no indications of active myeloma. And so this is an alert to the possibility that maybe myeloma could emerge in the future. And so for this reason, MGUS is called a precursor condition, something that can turn into myeloma. Fortunately, that rate of turning into myeloma is rather low, and it occurs only at 1% of patients every year. So only 1% can turn into myeloma. That means that 99% of the patients will still continue to have MGUS, which obviously does need to be monitored. We know that everyone who develops myeloma has actually had MGUS in the past. However, since only a small percentage of MGUS turn into myeloma, not all MGUS actually turns into myeloma. So the bottom line here is that MGUS is a very important precursor condition that we need to be alert to. It needs to be monitored, and there is a very large study ongoing in Iceland called iStop-MM, in which the screening for MGUS is being carried out with the idea of identifying MGUS early and assessing if patients might be in the category where progression to myeloma might occur, and allowing the possibility of an early intervention to prevent that progression to active disease. And so although MGUS is a stable precursor condition, it's a very active area for research, and by studying MGUS and its tendency to progress or not, we can really have a big impact on the ultimate outcome of individuals with this type of monoclonal gammopathy.